this opportunity to present what the Department of Health is doing in terms of readiness for infectious disease outbreaks and even pandemics. So I'm here to represent our Secretary of Health, who is now in Malacanang, to meet the President regarding her recent visit to Cuba last week, looking at the health system of Cuba, branded as one of the best in the world. So, galing po sa ating Secretary, it's time for her to report to the President. So, according to a consultant, Director of Health and Trust, pandemic infectious diseases are among the greatest of all threats to human health and security, against which we have for too long done little to prepare. So this is true in general, globally, but not really accurate in terms of the Philippine preparation and actions done. If you will see, wala pa po tayong major health threats that came from outside na nabuli pa tayo ng malaki. Meaning H5N1, SARS, MERS-CoV, Ebola, we were able to respond immediately to avert spread or damage to the country of these well-known threats. Because of that statement, in May 25, 2016, during the 69th World Health Assembly, wherein the Philippines also participated, the WHO member states agreed to establish a new health emergencies program designed to deliver rapid, predictable, and comprehensive support to countries and communities in preparation and recovery from emergencies caused by health hazards, including whether it's outbreak or whether natural or man-made. So, yung pong global threats natin, we can, ito po yung mga, the number of threats that came to the international community. But we can categorize this into three. Yung mga newly emerging infectious diseases, like the SARS, the MERS-CoV, the emerging infectious diseases is another category. Kasama po nito yung Ebola, which appeared in Africa and in some areas of the globe. And what we call the deliberately emerging infectious diseases. Ito yung because of intention to wreak havoc, katulad po ng anthrax that was experienced in the United States. So these are deliberate efforts to bring health hazards into the environment. So, what are the factors that contribute to development of pandemic in terms of infectious diseases? First is the demographic changes and the attitude. First, pag mas madaming tao, mas madaling kumalat ang sakit. And the people's behavior towards infection also changes. Like yung prostitution, these are also promoting risk to health. Environmental change, so climate change. Kaya po yung dengue is one thing that we are watching out because of these changes in the environment, climate change. Some areas which are not dengue areas in the past, ngayon po, may dengue na rin in the subtropical, hindi na dito sa layer ng ating bansa in the world. And also, El Niño and La Niña can influence the population of mosquitoes anywhere. Then also breakdown of public measures, public health measures during calamities, be it natural or guerra or man-made. This also affect the living condition of the people. Some are put into evacuation centers. Yung iba naman, damage yung sanitation and water and hygiene facilities. Also, microbes adapt to change. So we have this resistance to antibiotics. We have microorganisms and get resistance from common treatment that we are doing. So this present difficulty in managing and preventing spread. Also, the ease of international travel and commerce. So ito po yung isa rin that influence easy spread of disease from one country to country. And even changes in technology and industry can contribute to the imbalance in the ecosystem, which may lead to emergence of diseases or the development of new species of microbes. So we have this one. This is a conceptual framework developed during the set Asia-Pacific strategy for emerging diseases conducted in Manila last June. So ito po yung six areas that needs to be strengthened. Surveillance and risk assessment and response, laboratories, and for public health. Zoonosis, because most of our new diseases came from animals. Nagja-jump po ng species from animal to human species. Monitoring and evaluation needs to be strengthened also. Prevention of outbreak and public health emergency. And risk communication, very important. Because we need to appropriately and properly inform people so that panic will be averted and prevented. So these are the templates of a good public health emergency preparedness plan. And next is part of this is the joint external evaluation that the international community is doing. So out of the experience in the global health security agenda pilots from the WHO and other experts, na-develop po yung joint external evaluation tool. The purpose is to assess countries in terms of the readiness to respond to international health emergencies. So start with self-assessment, then review of action internally, then there will be group expert using the tool to evaluate how prepared the country is. So this is based on IHR, an international convention that is within the Philippines is also a party last 2005. Next slide. Ito po yung tool. It focuses on three areas, majorly the prevention, detection, and response. So under preventions, we have these several consideration, legislation, coordination with IHR, development of antimicrobial group within the country. So for the detection, we have to strengthen our national laboratories, improve surveillance and the reporting. And in terms of the response, preparedness, establishment of emergency operations, among others. So ito po yung content ng JEE, and you can skip this one. Yung sa Global CDC, ganoon din yung kanilang areas, prevention, detect, and respond. And in terms of the Philippine package, so with the CDC GHS, they are strengthening what we have now, the PIDS-SR, the surveillance reporting, and the events-based surveillance reporting system, which we are implementing already for so many years. Improve the incident management system for the response, and sustain our integrated national hospital-based surveillance. So, ito po yung sample, establishment of the Philippine Interagency Committee for Zoonosis, or PIHCS, and SS-SARI. So, ito pong dalawang to, meron pong legal basis. We have the Executive Order number 168 for the Philippine Interagency Committee for Zoonosis, and for the sentinel-based surveillance for SARI, or Severe Acute Respiratory Infection, we have the DOH issued memorandum 2014-0157, which includes the technical guidelines and standards and other instruction for severe acute respiratory infection. For this one, the SARI, we have 6 government hospitals established as sentinel sites. So we have in Manila, in Luzon, Mindanao, and in Visayas. And the non-sentinel sites, we capture this through our regular events-based surveillance system, the one I mentioned earlier, and the PITSAR, or the Philippine Integrated Disease Surveillance and Response. The RATM also have their surveillance unit, especially for influenza and influenza-like viruses, and the regional epidemiology and surveillance units in all the 16 regions of the country. So, as previously, our reporting is parang standardized, but now with the technology available, everybody, hindi na po isa lang, sakto. From the cases, the other one, it's immediately reported to the different layers of the bureaucracy, provincial, to the laboratories, to the regional, to the national, which is Epidemiology Bureau, and to the World Health Organization, which orchestrate international response. So we have this term, public health emergencies of international concern. These are serious health events that can endanger international public health. And as defined by IHR, EIC is an extraordinary event that constitutes a public health risk through international spread and potentially require a coordinated international response. Since 2005, ito po yung apat na PHEIC that has been declared by WHO. First in 2009, the influenza pandemic, or the H1N1 in 2009. Then the one-time polio virus. Kasi po we are in the brink of eliminating polio already. Next to smallpox, ang project po globally is to eliminate polio. And the Philippines alone has been declared polio-free since year 2005. There are only 2 remaining countries in the world that has still the white polio virus. These are, I think, Afghanistan and Pakistan. So, nung nagkaroon ng panic na konti when there are some reports coming from countries which have been declared polio-free. But so far po sa atin sa Pilipinas, polio-free pa rin tayo since year 2000. And of course, everybody is aware of the Ebola virus in Africa. And now, the most recent is the Zika virus, which not only affected Rio and Brazil, but now is also doing harm in Singapore. They have been doing a lot of things to prevent further spread and even international spread within ASEAN. Since 2000, we have this list of other diseases. Again, ang familiar lang sa atin, yung MERS-CoV in 2012, the pandemic H1N1 influenza in 2009, and the SARS virus in early 2000. Doon sa SARS virus, the DOH for a while isolated one barangay in the north. Kasi doon nagpunta yung namasyal pa yata from somewhere, umattend ng kasal. So, yung community niya taga doon sa isang barangay sa Ilocos. But all the rest are things that were imported from other parts of the globe. Some in Europe and America, yung Cryptosporidium. Now, in February 2015, the Department of Health Secretary approved our manual for preparedness and response for emerging infectious diseases. This is our Bible for the operationalization of emerging infectious disease program. So ito po yung pinaka-conceptual framework niya. We have these areas, policy development, capacity building, the initiatives that has been done already, the participation of the region and our partners. And overall, the goal, ang concept po nito, is not just the DOH or the government doing the effort. We would like to see at the end yung community participation. Just like in disaster, that real preparedness, real readiness is the preparedness of the community. Ganun din po sa health emergencies. If the community is prepared, then mas malaki po yung preparation rather than just DOH or the health manpower getting prepared for such events. So just for information, yung Interagency Committee on Zoonosis, ang members po dito ay DOH, Agriculture, and DNR. It was created to develop a national strategy and a functional and sustainable mechanism for the prevention and control of zoonotic diseases. So the other one, the Interagency Task Force or Executive Order number 168, these are the members. Din po dito ang DOH, we have the FA, because we now involve international events, DOLE, DILG, DOJ, Tourism, DOTC, and the National Defense. EO 168 was particularly issued in response to the MERS-CoV incident that happened 2-3 years ago. Mahal na araw po yun, kaya hindi namin malimutan. Wala kaming makasyon. We are reporting and being visited with the President himself kung kami nagtatrabaho at nagpa-contact tracing. So those minor comments just show that ang ating pong gobyerno ay hindi naman kulang sa pagkilos at preparasyon so that we can avert spread of these diseases in the country. So, ang sikreto po dyan, contact tracing. So, anybody who comes from outside with dalang sakit, we need to see all people na nakasalamuhan niya. Kaya pag umatin ng kasal, masakit sa amin yun dahil lahat ng nakasama na sa kasal, sa handaan, we have to take note and contact and ask them to report if they feel something different. So, we also have this 5-year strategic plan as part of our readiness. Ito na po yung bagong for the new administration. It was finalized last June. Ito lang June. And we are now implementing this. Ang pagkakaiba nito, we have strengthened collaboration and partnership among the different strategies that we are already doing. So, other important programs and updates, so you can just read this. We also participate in simulation exercises at the national level with the OCD. Then sa SICA, ito po yung mga SICA cases that we have recorded. The first one was a 12-year-old male from Cebu in 2012. The second was in 2016 January, a Filipino-American female who traveled from Tarlac, pagbalik ng US, nag-test ng positive for Zika, and that was how we learned of the information. The third and fourth cases were the brothers, Korean brothers, who traveled to Boracay, stayed there for a while, and when they went back to Korea, na-diagnosed them positive. And the fifth case was another Korean who visited Batangas in April. We have one recent reported case. The one came from Iloilo. Pilipino po ito. Pinapatis pa rin sa RITM because if ever this will be the first positive that we will see. We've been collecting specimen of Zika-like syndromes or since the reported last January, we've been collecting specimen, both urine and blood, and examine them for Zika. Wala pa po kami nakikita unless, until Saturday yata or Friday, when RITM reported a positive. So we have to do confirmation kung talaga dahil this will be the first time that RITM will be reporting a positive. But again, our statement is we have CCAS sporadically, meaning panaka-naka, meron talaga tayong nakikita. And there are reports from Cebu and other parts of the country. So, but the Zika that we have, the events, health events that we have, is not an outbreak. Like what Brazil is experiencing and maybe Singapore is experiencing. Sporadic meaning, from time to time, may isang lumalabas, but hindi naman nagiging potential for spread based on our experience. Probably some of the cases that we had are masked by the dengue reports. Isang possibility po yun. Kaya hindi rin kami wawalang bahala. We still continue collecting specimen and examining them. As I mentioned earlier, particularly the one that has recently been labeled positive by RITM medyo excited po kami. And we are looking at sa bata ng galing, meron po pong examination or surveillance na ginagawa ngayon ang Department of Health. But what we can say at this point is there is no local transmission. Meaning, yung may sakit ngayon na lipat niya sa marami, which will lead to an outbreak. So far, we can safely say that there is no local transmission of Zika in the country. Unlike what other countries in Asia or South America has been experiencing. So, as far as our action plan for Zika, para din po itong dengue, we still implement the 4S. May nadagdag lang na isang element. We would like in strategy number 3, management of the potential impact on women. Kasi what we are afraid, kung sakasakali, is the microcephaly that has been implicated as one of the complications of pregnancies who are infected with Zika virus. And other neurological effects like the transverse myelitis, the Guillain-Barré syndrome. So these are brought about by infection with Zika virus. So yung 4S po ng dengue, meaning ano yung 4S? Search and destroy the mosquito sites, mabuti pa kayo. Seek every consultation, pag meron ng naramdaman. Then, self-protection. So, use mosquito net, use yung mga pinapahit sa bala. And avoid say no to indiscriminate tagging and fumigation. Dapat pag lang may outbreak. Also, to prevent resistance of mosquito to insecticides. So, yeah, ito yung other pandemic threats that we have experienced. And this one is just to show you how complex is the response that we have developed already. Komplikado po, but this mechanism is working. This includes our connection with the WHO country office, because for international events, there are times that we need to report to the international health regulation. Ang purpose po nito, hindi na ito kumalat sa ibang bansa. So that's primarily the purpose. So it serves both ways. Para yung sakit sa isang lugar, hindi na kumalat sa atin, malipat. The same thing, kung dito sa atin ang galing, hindi na lumabas pa sa ibang bansa. And ang susunod. Yeah. In terms of the approach, there is no single solution. These are the key areas that we need to consider. Laboratory, network, partnership, outbreak investigation capacity. The intention is to improve national preparedness and response to emerging infectious diseases and emerging dangerous pathogens. May mga resistant na sa mga gamot at may mga hindi na tinatalaban ng ibang antibiotics. So this is our plan. yung four-door approach. Yan. Next. Wala na. Gusto na. We have the four-door approach. It's not part of the, I don't know why. But when we consider control of spread, we consider the point of origin. Ayan. Nakahain yata. The number 33. That's before I get 33. Yeah. So, we have the point of origin, point of entry, point of care in the hospital, and the epidemic surge, the point of increase. So, point of origin is to prevent the disease to spread to other areas. So, makonfine lang siya kung saan siya galing. Sa point of entry naman, to prevent entry of these diseases into the country. So, dyan po minomobilize yung quarantine. Kaya tayo merong yellow pad. Yung kung galing kayo sa airport, if you will note, meron pong yellow pad kami pinapakita. Please take this seriously dahil in the event, meron kayong kasabay na siya pala yung ating first case, katabi nyo pala, we need to know kung sino yung malapit, kung sino yung kasama, so that we can, as much as possible, as early as possible, curtail the spread and contain whatever hazard that is with you. Doon sa point of care in the hospital, dapat po mamanage natin ng tama, number one, to prevent death, but at least, pag napagaling na, yung opportunity to spread to other people in the hospital and even outside ay ma-prevent. And epidemic surge, number 4, fourth door, to prevent further spread and so that we reduce deaths in the community. So these are the point of consideration in managing our action to prevent infectious diseases and pandemic threats. So, tapos na yata. Yeah, and our battle cry of the new Secretary of Health, Secretary of Life, is all for health towards health for all. In the past, we've been talking about universal health care, which is our kalusugan pangkalahatan, exerting so much effort in what the health sector can do. But now we are strengthening the help that we can receive from all sectors, other government agencies, the media, the community themselves. This is where we are now putting emphasis so that because without you, without them, we cannot manage it by doing it DOH or the government alone. So maraming pong salamat in behalf of the DOH and our